Early autism signs parents need to know. First off, let's talk about communication. Is your baby using hand gestures like pointing? Responding to their name? Engaging in pretend play? Saying those first magical words by 15 months? Stringing together two-word phrases by age 2? These are all key milestones to watch for. Red flags could be things like losing language skills they once had, repeating words or phrases without really understanding them, or mixing up pronouns. Next up, let's look at social cues. Babies are little sponges, soaking up all those social interactions. So take note, does your little one smile back at you? Follow your pointed finger to see what you're looking at? Bring you cool things they've found to show you? These are all great signs. On the flip side, struggles with eye contact, facial expressions that don't quite match the situation, or difficulty making friends could point to autism. Now, let's talk about behaviors. Repetitive actions, sensitivity to certain sensory input, intense interests in specific things, these could all be pieces of the autism puzzle. Maybe your kiddo walks on their tiptoes for a long time, gets super focused on parts of toys rather than the whole thing, or has a really tough time with transitions and changes to routine. But here's the thing, no two kids with autism are exactly the same. The signs can vary a ton in number and severity. And of course, some of these traits show up in kids without autism too. So don't panic. If you have any concerns or questions though, don't hesitate to bring them up with your child's doctor. Speaking of doctors, let's talk about how autism is actually diagnosed. Unfortunately, there's no simple blood test or brain scan that can give us a clear yes or no. Instead, pediatricians use developmental screening tools, basically questionnaires and checklists to see if your child might benefit from a closer look by a specialist. The American Academy of Pediatrics recommends this screening for all kids at their 9, 18, and 30-month checkups, with an extra autism-specific screening at 18 and 24 months. If anything seems out of the ordinary, your child may be referred to a developmental pediatrician or psychologist for more in-depth testing. So what causes autism? The short answer is, we don't fully know. What we do know is that there are certain factors that can increase the chances, especially when combined with genetic predisposition. Things like having a sibling with autism, certain genetic conditions, birth complications, older parents, and exposure to air pollution or pesticides while pregnant. And let me be crystal clear, vaccines do not cause autism. That myth has been debunked by dozens of studies looking at over 1 million children. If your child does end up with an autism diagnosis, know that there are so many interventions available nowadays to help them thrive. We're talking behavioral therapy, speech therapy, occupational therapy, all tailored to your kiddo's unique needs. The earlier the intervention, the better the outcomes tend to be. Kids under 3 can access early intervention programs, while those 3 and up can get support through special education services at school. Before we wrap up, I want to touch on one more common struggle for kids with autism: sleep. Between 50 to 80% of children on the spectrum have disrupted sleep patterns. The good news is, there are lots of tricks to try. Weighted blankets, gentle brushing, snug swaddling, calming scents like lavender, blocking out extra light, these can all help signal to the body that it's time to rest. So there you have it, a crash course in the early signs of autism. Remember, you know your child best. Trust your gut, and don't be afraid to advocate for your little one. Thanks for tuning in to Little Kids Lessons. If you found this helpful, be sure to like and subscribe for more evidence-based parenting tips.